Afternoon, everyone. Welcome to the Slice of Lime webinar today, the first one of ours in 2021. It's great to have a lot of people online joining us. First, I'd like to just start off by acknowledging the traditional owners of the country that we're on today in this virtual space throughout Australia and Aotearoa, recognising their continuing connection to land, waters and sea and culture, and pay my respects to elders past, present and emerging. Today I'm actually on Wurundjeri country of the Kulin Nations and pay my respect to those elders as well. We're going to get straight into it because we'd like to have time at the end to have questions. So first up today, we have Miss Candice McKenzie, the Associate Head of School of Indigenous Strategy at Deakin University, and Candice will be speaking on highlights and challenges for teaching Indigenous health online during a pandemic. Just a quick, before we start, we are recording the webinar today and that we will give participants an option to opt out of the recording later when we share the video around before it goes online. And we also have a Twitter handle as well today for those that are active tweeters, and that'll be put into the chat. But over to you, Candice.
Wonderful, thanks Shane. And a quick thank you to the Lime team for inviting me to participate in today's session. As Shane's already indicated, my name's Candice. For those of you that I don't know, I'm the Associate Head of School Indigenous Strategy. I'm a Warramungu Warlpiri woman from Darwin, born and raised in Darwin, but with ancestral connections to Tennant Creek and to Yuwindamu, this country. I was asked today to have a bit of a chat about the challenges and highlights for teaching Indigenous health online during a pandemic. And it's probably helpful just to preface this with, I expect that each of our experiences are quite similar. So I'm hopeful that I'll at least share with you one or two things that might be a little bit different for people to be able to draw on. Before we get started, I want to acknowledge that as we gather today, physically dispersed and virtually constructed, let us acknowledge elders, past, present and emerging, of all the land we work and live on, and their ancestral spirits with gratitude and respect, and to recognise the continuing connection to land, water and to community. I'd like to pay particular acknowledgement to the land of the Wadawurrung people of the Kulin Nations down here in Geelong and Victoria, and pay my respects in particular to the elders past, present and to other people in the room. Thanks, Lilon. So the pandemic, it's really changed the way that we live, work and the way that we communicate. And across universities, teachers and the like, we've had to quickly redesign our courses and deliver them virtually, even as the pandemic continues to bring new challenges. And who perhaps would have thought that pre-COVID we were being condemned perhaps for the use of how much time we actually spent in the virtual world. And here we are now as the main source for how we stay connected and keep in touch with one another. But I guess what's perhaps missing from my presentation title is this last point here that I raise, which is, whilst there's certainly been, and no denying that there's been a lot of challenges, I think what that's actually done is provided a great deal of opportunity for us as we look to new ways for doing and thinking. So I just wanted to start with a little bit of background for those less familiar with Deakin's program. So we're a 4-year medical program, postgraduate medical program. And Indigenous health forms absolutely a fundamental part of the way that we deliver our curriculum. Our curriculum, we're very, very fortunate. I've got a fantastic group of people that I work with that we've been able to, up until this point, for the almost now 7 years I've been working with Deakin, we've made huge strides in being able to align our curriculum both vertically and horizontally, and not just in parts of the curriculum or certain years, but certainly across the entire 4 years. We've got lectures that sit independent as part of our Indigenous health theme, and then we've got lectures that sit integrated across the various themes within the program. And embedded through, we're thematic, so embedded through the various other themes, so public health, our ethics, law and professionalism, our medical sciences and clinical practice theme, and then also well into the clinical years for where students in 3rd and 4th year are dispersed across a number of different clinical sites. We start our Indigenous health teaching and learning quite early, within the first couple of weeks of the students commencing at Deakin, and we start with a 3-day immersive experience where the emphasis really is on just unpacking what is Indigenous culture, who are Indigenous people. And then we sort of up the ante for students as they move through the 3 days to a case-based discussion or case-based analysis, if you will, around really unpacking conscious bias, unconscious bias, racism, amongst a number of other things, really through the use of facilitated discussions. And we build on that across the years and across the various themes, and we unpack issues of racism. We also look at cultural humility and the practice of. We look at white privilege, we look at Aboriginal health interventions, preventions, and then we sort of move our way through up until 4th year where students actually get to engage in the practice of. So we provide a number of different clinical placement opportunities for students both locally and nationally with our various partners, explicitly in Indigenous health. And it's really important just to acknowledge that perhaps the biggest challenge, at least in teaching Indigenous health and as Indigenous people, I think that's really important to acknowledge, is that Indigenous culture is fundamentally characterised by our human interactions. We each know that it's relational, so it relies on this relationship with one another and with other parts, and really communication. And I'm a big believer that communication is key to how we at least teach within the Deakin MD program. So the pandemic has really brought about increased chances for disconnection, and we needed to find new ways to stay connected, not just personally, but obviously as we teach Indigenous health. Thanks, Lauren. I just wanted to highlight the challenges, and this first one is perhaps more related to me as an individual, as a teaching staff member, rather than the challenges of teaching Indigenous health. It's a less commonly used method of teaching for most of us, I think, regardless of what discipline you might be teaching into. Some of us are a little bit better or perhaps a little bit more adept at online methods. I certainly am not one of those people, so it was quite a personal challenge for me to move to the use of digital literacy. And the other perhaps biggest challenge was the uncertainty around our student engagement. Students at the best of times, and perhaps this might be similar experiences for many of my colleagues, is often quite small. We often have a small number of students that attend our face-to-face lectures, and it was to my surprise, in fact, that when we transitioned to an online platform, that our attendance, our student attendance, and in particular our student engagement actually grew exponentially. In fact, we went from 20 or 30 students up to often what was 50, 60, and sometimes even more students as part of our online platform. Thanks, Lilon. So what were the highlights? So we really did use COVID as a teachable moment for our students. And I realised that the importance here is obviously in discussing Indigenous health and how we use that as a teachable moment. But I think it's really important to acknowledge that it was really, really useful to be able to just teach around or highlight the themes and issues of marginalisation, equity and human rights generally, and not just specifically to Indigenous people. So really acknowledging the impact that it's had on these things in particular. So we're able to utilise that and really hone in, I guess, and highlight exactly how these things operate and manifest. It was really an opportunity to diversify our participants and our audience and allow more people to access course content remotely. Often in particular spaces like medicine, it can be really difficult to engage, specifically probably people that we bring in to do a lot of our teaching. And through COVID, the use of online platforms was really helpful for us to engage a number of different people whilst not troubling them or, I guess, boring them or taking them away from other activities that they need to be or work that they need to be a part of. We're also able to avoid longer sessions and incorporate a lot of extended break times. And we were able to significantly reduce often what is didactic teaching and learning and really engage with newer ways for doing. We have, I guess, typically and historically or at least in the last couple of years, moved more and more toward this idea of flipped classrooms, but it was really an opportunity during COVID to highlight the use and the importance of things like a flipped classroom. A lot of engagement from students, the ability to be able to use case-based studies and actually have some of that problem solving even then during online platforms. And then that last point just there, which is to really be creative and innovative in what we did and how we did things, rather than just prescribing required texts to students. So we were able to adapt and use different types of multimodal content, be it podcasts, case-based learning, whatever the case might be. So they were some of the highlights in particular, I guess, for us at Deakin. Thanks, Lilon. And I just wanted to share briefly the biggest opportunity for us perhaps is that, and I'm reluctant to say this, I think sometimes, because I understand that COVID was a difficult time for many people for different reasons, but at least from a professional standpoint or perspective, perhaps, that it was actually a real opportunity for us, me and my team, to actually slow down and to really acknowledge what we did have, or perhaps where the gaps were in our curriculum. And from that, we've been able to develop a number of online modules and teaching and learning materials as a result of the time that we got given back, if you will, during COVID. So thank you.
Thanks, Candice. We have a question, but again, we'll do that at the end of the session today. We'll open up for questions. Next, we have Dr. Kim Isaacs and Professor David Paul from the University of Notre, Fremantle, speaking on the impact of COVID-19 on the University of Notre Dame, Fremantle School of Medicine, Kimberley Learning on Country program. Thanks, Kim and David.
I'm based down in Fremantle, and today I'm talking to you from Wajak Noongar Budja, and Kim's up in Yari country, where I was for the last couple of weeks and had to come back yesterday to the cold. Over to you, Kim.
Hi everyone, Nadja Gorgon. I'm actually talking from Yari country, and I think I'm having issues trying to get the slides up. I think you're still seeing the next one. Oh, is it all good?
Yep.
Okay, that's great. So hello, welcome from Broome. My name's Kim Isaacs. I'm a GP up here in Broome in the top of Western Australia, and I'd like to say thank you for the honour of presenting our immersion program on Kimberley country. Thank you, Dave, who will be co-presenting with me. Okay. So we'd like to acknowledge the land they actually are meeting on. So I'm on Yari country. My family are traditional owners here, as well as I'm a traditional owner from Bijadanga, which is a remote community south of Broome, otherwise people known as Bijadanga. And Dave?
Yeah, and I'm a non-Aboriginal man who's had the fortune to work alongside Aboriginal people for a very long time in this education space.
And I'd like to acknowledge, Dave meeting on Wajak Noongar country. It's great that we've got a campus of Notre Dame University that's in Fremantle as well as in Broome. So, Dave, would you like to do this slide?
Yeah. So the school's had a long tradition of wanting to give meaningful rural opportunities, and one of the initial steps was to send all students in second year up to Derby and do a rural immersion, which was based around placements being co-hosted by families and spending time working alongside people. Since we've started to build the Aboriginal Health Program over the last 8 years, we have been gradually building the recognition of being on country and what that means, and getting the school to the point of being very, moving from a nice mission statement and aims of building practitioners who can work with Aboriginal people, to getting them to understand that they're meaningfully on Aboriginal land wherever they are. And part of our program has been to steal little bits of curriculum time and steal opportunities where we can to give some students more meaningful engagement. So one of the things that we did from 2015 was to use that 1 week time in second year to go to Broome and spend time in Broome with Kim and others to build the opportunity to do a strengths-based program where we're giving students the opportunity to think about what community organisations do to provide the opportunities to better meet needs for community, build opportunities, build capability, build resources and build services. So very much trying to counter the deficit model that invades too much of medical education. And having a campus in Broome with accommodation, having great colleagues like Kim in Broome made this a really easy project to start to use as one of the stepping stones of our learning project. But what happened last year was that we didn't send anyone, and the Derby-based mob were going ahead organising a virtual program, and we did remind them that perhaps Broome was an important place to consider, and we got 3 morning sessions set aside where we could not only work with the students that we'd normally work with, but with a whole cohort to give them an introduction to what happens in Broome, and that formed the centre of this program to undermine some of the rural tendencies that forgot sometimes that Aboriginal health and Aboriginal people were important in this process. So over to you, Kim.
Yeah, so the school historically for 10 or so years or so have actually run a Derby immersion program on country, and so we ended up doing a Broome one. So that particular 1 week of VCing that we did was to encompass the two programs, and made sure that we had the Broome content for 3 days, and had a fixed time of 8 to 10 to put our content that we always, basically I think our best sessions when we do our 1 week immersion program physically up here, that we made sure that we highlighted various topics that our students have always liked to enjoy learning from. So one was on Tuesday a session with our local traditional owner organisation, which is Nyambaburu Yaru, and having myself and Paul presenting that. On Wednesday, working in primary healthcare in the region, because I think the students need to understand the dynamics of healthcare services up here in order to appreciate the complexity of our region from a health service delivery point of view. And Thursday we did actual tour with Bart Pigram. So when we did the Tuesday morning Yari session, Paul is my husband, who it's been great to have him talk to our students because he, can commit. And they learn about this philosophy of Maba Lian, which is the guiding principle for our people, and it's good well-being. Lian is a word for our well-being, which encompasses the spiritual, emotional, and physical well-being of our people. And they learn about the journey of winning native title in 2006 and leveraging then programs in the community, working with state government, having a say at the table with how the town site has developed, and this wonderful facility that they learn about that Yari have built, which is a wellbeing centre. And they go through that process with myself and Paul talking about the native title journey, which took 10 years to fight in the federal courts that our family and community had won. The next session on the Tuesday was working in primary healthcare in the region. And see, a lot of our students do want to come work regionally. We always have them put up their hands to, at some point, wanting to do either a medical placement or maybe work in the future up here. And to understand doing this particular presentation really highlighted the point of just how complex the health services are from an AMS, Aboriginal Medical Service model, as well as Royal Flying Doctors, as well as state government clinics. and talking about the journey of training that they can actually do as part of being medical students, or GP training in our primary healthcare clinics, as well as specialist training that can happen up here. So we just talk them through some of the dynamics of working in remote healthcare, and catching planes and driving out cars to remote communities, and the type of presentations that we'll see in a clinic and so forth. So yeah, and the next session on the Thursday was the tour with Bart Pegram. This, I think, was the most, this particular session, which I think was the highlight when we get the feedback. Bart Pegram has been doing this particular tour. If they would have been here in Broome, they would have, Bart, would have taken them on site we do Kennedy Hill. We start off there, which is this big shell midden that you can see here in this picture. And Bart's a wonderful Yawuru young fellow who has got his own tour company and is a great storyteller. And what we did for this particular session is that I used my iPhone, and apparently the iPhone had a really good quality footage, because that was the feedback that I was given. And then Bart does the storytelling from the hill, which is an amazing shell midden that's been built up over thousands of years from camps. And he talks about the local stories and our families that have grown up on that hill, and really engaging talk. And that's why we like to use Bart every year, and it's very interactive. He then takes the students then on a walking tour into the town site itself, looking at the natural plants and the bush medicines and so forth. What did happen in this session though is that my iPhone battery did drain out, so if anyone wanted to do this, just remember that have a backup of an iPad. So I'm glad I had an iPad to finish off, because I think my iPhone only lasted the 1.5 hours out of the 2-hour session. Bart also used a drawing on the sand as part of our skin groups that we've got, and he paused a lot in his sessions to ask a lot of questions. So even though our students would have loved to have physically been there, I think we used a lot of pausing for them to ask questions. So it was back and forth interaction. I will hopefully maybe give you a video link at the end of this that we can actually give an example of Bart's tour, because I don't want to stuff up my screen here. But our students always comment on wanting to learn about culture. It's whole part of the point, I think, of coming and doing, learning on country, is to do this kind of stuff. So that's the link. I might perhaps play it at the end if we've got 2 minutes or so, but otherwise you can just take note of that particular link and see Bart in action as part of a video. In terms of just going backpedaling a bit about the issue about putting students on country, is that our region and some of our remote communities in inland WA had the Biosecurity Act, which is the federal government, that basically said, our communities, access to them was not for outsiders. So we had very strong leadership in our senior people at Notre University that made the decision, yes, it's too risky to put our students, that could be, could be carriers, or could be having COVID-19, and because of this Biosecurity Act, it was a no. And I think we had to explain the seriousness and the reputational damage from a university perspective if the students did come up here and taking the risk of whether whether it was iffy if they might have been having COVID or not. So I think the students, through the senior leadership and through me and myself up here and other doctors up here, actually telling the students firsthand to say, no, we don't want you up here, so physically up here. So I think they got their heads around it, and they weren't happy. A lot of them really psyched themselves up for second year doing the immersion on country programs, and for them to say no, I think at first they were unhappy, but they got their heads around it and then accepted the fact through us and Community Mob actually saying we need to protect our communities. So doing the local negotiations was very important, and having that community voice come through about the risk. Feedback. So as you can see in the blue, Bart's program was very popular. Oh.
Sorry, Kim, just got 1 minute left, okay?
Okay, great, thank you. And obviously, from this perspective, that I think this is the crux of it, to say that interactive experiences are what the students are wanting. They want to learn about culture on country. So that if you want to learn more about Bart himself and some of his videos, this is a great one there. So thank you. That's Dave. Did you want to say anything else? Okay, all good. Thank you.
Yeah.
Thanks, Kim. Thanks, Dave. Next up, we have Jeannine Stairmand and Rhiannon Jones from the University of Otago, Wellington, talking about modifying Hauora Māori teaching modules for the online environment. Over to you, Jeannine.
Kia ora, ko Jeannine Stairmand tōku ingoa no Ngāti Porou. I'm the convener of Hauora Māori here at the University of Otago, Wellington, and I would like to thank you for the opportunity to share our experience with you today. Rhiannon.
Tēnā tātou katoa, he uri tēnei no Ngāti Kahungunu, ko Rhiannon Jones tōku ingoa. I'm Rhiannon. I hail from the east coast of New Zealand, and I'm one of the professional practice fellows at the University of Otago, Wellington. Thanks for having us today.
Can I just confirm that the page that you're seeing has changed?
Yeah, it's all good.
Great. Tahuhu kōrero, a little bit of background information about our teaching. So just to locate you perhaps first of all, so we're based at the University of Otago, which most people associate with Dunedin, which is the larger red dot on the map of Aotearoa, New Zealand there. And a little bit further up are our colleagues based in Christchurch, and we're the lighter red dot there based in Wellington. We deliver our course based on the curriculum, the Hauora Māori curriculum, which aims to prepare graduates to work alongside Māori patients and whānau, providers and community to support Māori health advancement. Our curriculum acknowledges Māori as the Indigenous people of Aotearoa, the ongoing impact of colonisation and racism on Māori health, and supports Māori community initiatives and following Māori health leadership and guidance. Our curriculum also encourages us to work with our students around the delivery of services that support equitable health outcomes for Māori, and also to become advocates in the health system that could influence policy and changes which might aid or improve health inequities, while at the same time ensuring that it can cater to the diverse needs of Māori within communities. Te tiro whakamuri, kōkiri whakamaua. So this is a bit of a proverb which encourages us to look back and reflect so that you can move forward. And this is one of the mind spaces that a number of Māori were in when COVID started to take off. We'd obviously had experiences with epidemics related to colonisation, in particular the introduction of infectious diseases such as influenza, measles and sexually transmitted infections from the likes of Captain Cook and his crew as an example, and the impact that those kinds of things had on our birth rates, sterility, stillbirths and deaths of course, and the 1918 influenza pandemic as an example there. If I orientate us back to a year and a bit ago, I guess it seems much longer on some days and then like it was just yesterday on other days, but reflecting back, COVID-19 in Aotearoa started to take off towards the end of January, and then by March we were being moved into situations where we were being limited to 100 or less people being able to gather at a time, and the impact for us is our 4th and 5th year cohorts are just over 100 in each one. By what was it? By the 27th of, by the 25th of March, sorry, we'd moved to alert level 4 after transitioning through alert levels 2 and 3, which essentially meant we had to pack up our offices and quickly scoot home, hopefully remembering to take everything that we needed potentially with us, not really knowing how long was this thing going to take. Now, to our next slide, just to focus in a little bit on our teaching and what we use to hang or guide our teaching off is models such as the Hui process and the Meihana model, which hopefully many of you are familiar with, and if you aren't, there are readings by Lacey and Pitama, which you could go to and have a look in more detail at those models. What I'd like to do is just draw your attention to the 4 red stars on this drawing. And so what they are highlighting is what we call ngā hau e whā, so the 4 winds, which are influencing the journey of Māori patients in whānau. And those 4 winds consist of marginalisation, migration, colonisation, and racism. Yeah. For our teaching session that we're going to share a little bit more with you around, we're going to focus on the ngā hau e whā session that we had scheduled with about 108 fourth year students in April 2020. So just a reminder again, the 4 components of that ngā hau e whā elements of the Meihana model were colonisation, racism, marginalisation, and migration. So there, if I just talk a little bit about some of the nitty-gritties and the big picture issues that we were trying to grapple with at the time. So there were things like, obviously there were massive amounts of emails that were dropping down from all over the place, as well as amongst our own team. There are multiple Zoom meetings that were going on. People had to obviously sort out their IT, internet access, VPNs, using different platforms that we weren't familiar with. For the particular session, ngā hau e whā, we take a bit of a team approach and we share leads. And Anaru Wā, one of our colleagues, he led this session. Unfortunately, he's on leave today and can't be with us. The other elements that we wanted to just acknowledge though too with moving online to teaching is that lecturers themselves had to sort their own families out, children, their parents perhaps who may have been elderly and needed their care sorting out. Obviously being able to go to the supermarket and just sort their own basics out, kai, and dare I say, toilet paper. At the same time, on a big picture level, we wanted to embrace the opportunity of living and teaching in this pandemic kind of real-time space that we found ourselves in, building off previous year's content while staying true to our curriculum aims and teaching objectives. We also wanted to recognise that the students were facing challenges. So some of them had computer access issues, internet issues, their own living arrangements. Some of them moved home during this period. Money was an issue for some, and kai, just as examples. So let's just focus in a little bit more on the ngā hau e whā session content itself. So just a reminder, we had roughly 108 fourth year students that we were designing this session for. We had about 3 weeks to revise and prepare the session alongside our other roles and responsibilities that we have here at the university. Many of us are also involved in research as an example. Right, so the ngā hau e whā session itself, its focus was on deepening the understanding of how to apply the Meihana model, Meihana model's ngā hau e whā components to clinical practice. The session components consisted of background readings. We were really fortunate to get some really amazing pre-recorded lectures for the students to have access to, and then we drew on those into live breakout sessions using Zoom there. I just want to draw your attention to the old saying on the right there, toko toko rangi, which is kind of alluding to a spear, which kind of comes from the old time of a warning, of a supernatural force nature, if you like, and based on our people having experience with pandemic or quite catastrophic type events there. So definitely a warning period for all of us. It was a period of fear a lot of unknowns as there were all around the world happening. Our pre-readings there, I'm not going to go through them all, but just to acknowledge that what we're trying to get in the midst for our students was to challenge them about inequities and how they're framed and how they could be framed. How we wanted to provide them with some more information about colonisation, past and present. Where was our Ministry of Health heading in this space? And also, when we say equity is important, what actual actions are we doing to help improve equity there? Now, I just want to say as simply as I can, the recordings that we were able to gather in this short time frame is the kinaki, or the relish of, I think, this particular session. And it was such a privilege to be able to have these people do the recordings for us. And I'd like to acknowledge particularly Carwyn Jones. He was a lawyer from Victoria, or is a lawyer at Victoria University. Carwyn helped set the scene with our students and challenged them to move their thinking around te tiriti and health forward further in the, particularly regards to the legal context, moving forward from principles into thinking about legislation, Waitangi tribunal claims and settlements. We also had a panel as one of our recordings that they were able to watch, and we had I was going to say infamous, Donna Cormack talking about the impact of racism on health, and she focused on COVID-19 and particularly shared some information around Te Rōpū Whaka Kaupapa Urita, which was a national Māori organisation set up to provide expert advice for Māori. Donna also spoke about the challenging environment to collect ethnicity data during this COVID period. How did we know what the impact was on Māori if we weren't collecting ethnicity data, which wasn't happening initially? And also, how were Māori travelling? And so in some instances, in some community, Māori went harder and earlier, set up roadblocks, for instance, were distributing food and hygiene kits before the government got organised and activated. Paula King challenged the students around their thinking around the Crown's accountability in the equity space, and to think about those who are oppressed in oppressed situations, our whānau that are in prisons, care and protection, disability spaces, for instance, there. But also to draw off the successes of Māori providers that was already starting to emerge, but at the same time reminding us to be very, very careful around transmission and identifying those who are really vulnerable. Those, obviously we know Māori have higher rates of comorbidities than non-Māori here, access to health services, particularly primary care issues, and the like. The other person I'd like to mention is Cheryl Davies. She was the manager for one of our local Indigenous health services, Tukatahi Māori Asthma Trust, based at Kokiri Marae and Seaview. I have got a link on the slide there to about a 4-minute presentation about some of the work that Kokiri was involved in, which we may be able to share a bit later on. She shared with us and the students the experience that was happening on the ground. So there was this national policy level stuff going on. Supermarkets were limiting food amounts that people were able to access, but how did that work for many Māori who had bigger whānau, where whānau had grouped together? How was their health and well-being going to work? They were having trouble paying bills, affording prescriptions, food banks were closing. There were some really big issues going on in the community there. And she also shared with us her experience of Māori providers pulling together during that time to address this issue. These presentations enabled us to make linkages to our course aims and learning objectives, which was fantastic. So we were able to draw on those presentations and the—
Sorry, Jeannine, running out of time. Yeah, 1 more minute. Is that okay?
Yeah, this is my last slide, so that's perfect. So we were able to draw off those linkages and take them through to our Zoom sessions with the students, and undertook 3 activities with them to bring it from that kind of high level and community level into, for them as a clinician, how they might be working with whānau in a clinical space. And he mihi mahana. If you have any queries, please email me, and if we get a chance, there'll be questions at the end. Kia ora.
Thanks, Jeannine. So next up, we have Dr. Karen Fildes, Dr. Marlene Longbottom, and Professor Kathie Clapham, from the University of Wollongong, speaking on the cultural practice in healing and recovery, learning from elders and community in Zoom, in community via Zoom, adaptations and inspirations on keeping it safe, authentic, and reciprocal. Thank you.
Thank you, Shane. It's Kathie Clapham. Our team is delivering from different locations across Australia. Karen and I are in far south coast. We've been visiting south coast communities impacted by the 2020 bushfires, and Marlene Longbottom is will be talking from Cairns. I'm the director of the Narrawandju First Peoples Health and Wellbeing Research Centre at the University of Wollongong, and working in collaboration with the School of Medicine at the University of Wollongong, where we're delivering a Indigenous health curriculum. And particularly want to be talking today about the cultural practice and healing and recovery practices that we've delivered virtually over the last 12 months, and focus on keeping safe. So this collaboration in 2020, this is particularly around the graduate certificate in Indigenous Trauma Recovery and Practice program, which was offered for the third time in 2020, and it was offered completely remotely, having been previously it contained both online delivery and a face-to-face residential in previous years. From the community, we drew on elders Auntie Lorraine Brown, Auntie Norelle Thomas from Kumadichi, United Aboriginal Corporation, also from South Coast, Raymond Timbry, Jess Kaur and Joe Williams, who contributed strongly to our program, and from the institution, from Narrawandju, myself.
Sorry, it's on automatic timing, so I have to keep flicking it.
Dr. Marlene Longbottom, Dr. Elizabeth Dale, and Ms. Georgia Stewart, and from the School of Medicine, Dr. Josie Atkinson, Dr. Karen Fildes. We also collaborated with Professor Dawn Becerra from University of Western Australia, Professor Marshall from South Australia Health, the We Ally. We had the strong input from Professor Judy Atkinson, which we draw on her considerable expertise in this in the trauma recovery program.
So Marlene, did you want to talk about how we tried to keep it safe online when we were talking about tricky subjects?
Yeah, I think because the content of the work that we've been doing around trauma, we need to hold space and keep that safe and supportive space in for the students as well as the people delivering the courses. So with COVID, it kind of threw a curveball about how do we do this in a culturally safe way that it's still, you're able to still experience what you might have experienced when you're face-to-face in a residential situation, but also have the cultural safety, but also the support that's there in that thing. So we were trying to make sure that that the course was delivered as authentically as it was when it was face-to-face, but obviously through a virtual space, which was quite a tricky way of delivering the course, given that we're talking about trauma and quite difficult topics. But I think the way in which we've transferred from the in-person to the virtual spaces has been a massive lesson. And it's also been increasing access to the course, which meant that people didn't have to leave their communities to travel to Wollongong. So we've tried to meet a lot of different points in terms of where people can access the training, but also making sure that we're maintaining cultural integrity, that we're also keeping people safe, like the elders and the presenters. Joe Williams and I presented on violence, so we violence and trauma, and how that manifested with in different spaces than what the students might have experienced or in their workplaces and stuff like that. And the aunties, Karen might be able to tell you a bit more about the designing the artwork and things like that. But it was very much about how can we use this tool, the virtual tool, in a space where we can also deliver the training and make it accessible, given, you know, the restrictions of movement and that sort of stuff with COVID, without having the course like paused for a year. So it was because we're still getting people really interested in doing the course. So it was more about maintaining cultural safety and the integrity, and also the space to make sure that, you know, people weren't re-traumatized, and if they were, we would get support, because we have a lot of different students coming from a lot of different backgrounds, not just medical students.
Okay, so thanks, Marlene. I was just going to talk in detail about the different programs that we put on, because what normally would have happened in Indigenous trauma recovery practice is that we would have had a week-long residential, and of course, as the title of the graduate certificate suggests, it's practice, so it's really supposed to be a hands-on experiential immersion in cultural ways of knowing, being, doing, so that you utilize those traditional skills in healing and recovery. And the cultural practice was in the face-to-face environment, was delivered in the past by different elders in the community and different community members. So what we had to do was then deliver that same cultural practice for healing and recovery in a Zoom space, which is obviously tricky, as everyone's experienced. So we did a similar thing to what you guys did up in Broome. We did it on Zoom, but we took a film guy with us, and so we went out onto country with a film person walking along with the community member who might have been talking about bush tucker or might have been doing a smoking ceremony, and we were filming it and zooming it live at the same time. We went out into community with the aunties who did that artwork that Marlene was talking to, and they sat and did art while all the students sat in their respective places with their own art tools and their own canvases, and they did art while the aunties yarned. So that was sort of the first one, cultural art, a tool for trauma-informed facilitation of healing. And there was a lot of interaction with that. And then the students had to then post the art that they produced and talk about their stories in that art. Another cultural immersion thing we did via Zoom, and we held these a couple of times throughout the session, which was a way upper work. For those of you who aren't familiar with that, it's a traditional practice that is meditative and grounded in country and mother. And so we held quite a few of those on Zoom, just like everyone was doing exercise classes on Zoom. So we had these sessions on Zoom throughout the course. And the other one, connecting to culture on Yuin country, that one was walking through the bush with one of the traditional custodians on Yuin country, and we held a smoking ceremony for that one as well. And then we also had the traditional sort of podcast type discussion spaces. Now there was loads of interaction in the chat on all of these sessions, and also students would turn their cameras on quite a lot and have conversations. So all in all, our feedback was that these all worked really well. So the medical students whose placements and cultural immersion programs were completely cancelled in 2020, but of course we still couldn't really do them in 2021, but we learned so much from Indigenous trauma recovery that we then utilised that way of getting that cultural immersion via Zoom for the medical students. And I did have a film here for you to have a look at, but unfortunately, because we are in a regional area, when we tested it, it just was really jerky. So I can't show you the film, but we'll paste the link later. But this is Raymond Tilbury here. So we walk through country with Raymond. We've got the film. We've got the iPhone that's zooming, getting the hotspotting the internet, and Raymond's talking about bush, and he's talking about country and all the meanings of the different animals and plants on that country. And then we sit down and Raymond holds a smoking ceremony, and he explains the smoking ceremony and what it means and all the traditional stories that go with that smoking ceremony. And then he finishes the session with a bit of didge playing. So all the feedback from the students, because we had the camera so close to the fire and so close to Raymond, that they felt like they were in the smoking ceremony. So the smoke was sort of coming into the camera and sort of swirling around. And he's such a great orator that it just created this amazing environment. So we've done a few things like this with the medical students since, and we've gotten really good feedback on that from those students as well. So that's sort of, I guess, the moral of the story is that it created these opportunities for us where we just thought, oh my God, this is never going to work. And it totally did. And then we've sort of built on it from there. And I think we're getting some really good responses. So that's us.
Thanks, Karen, Kathie and Marlene. We've looks like we've actually run out of time today. There are not really any questions in the Q&A, but I'd just like to, thank everyone for such a fantastic session. We really appreciate everyone's contribution today, and I've learnt things, which is great as well for me. And what we'll do is we'll just remind you that this session has been recorded, and we'll be sharing it once we've managed to edit it. And we've tried to put a few links in the chat session for you as well to follow. And I think if there was another link that's still missing that we'll try to sort out later, but we'll do our best to share all the links and papers for those that attended today, and just want to thank everyone again for coming.